Hi, I'm Frank Diamond, the managing editor of Infection Control Today. We're giving infection preventionists and other healthcare professionals the information they need as they battle COVID-19. Joining me today is Dr. Anthony Harris, who is the Chief Innovation Officer and the Associate Medical Director for a company called WorkCare, which helps companies with their occupational health situations. Dr. Harris builds disease prevention programs and offers advice on managing the workplace in terms of automated daily screening, risk assessment, testing, and return to work clearances. Dr. Harris, thank you so much for joining us here at Infection Control today.
Thank you so much, Frank. Pleasure to be here.
We're hearing more and more about the possibility of infection preventionists moving out of the healthcare system and into private industry or school systems or something like that. If not an infection preventionist herself, then at least infection prevention expertise. So when I introduced you, I used terms like automated daily screening, risk assessment, testing, and return to work clearances. They sound very much like something that infection preventionists might become involved in. Is that a fair assumption?
Absolutely. Yeah. And when we talk about prevention, certainly the epidemiologist, myself included in my training, and the infection prevention specialist, spend probably most of their time doing prevention, right? It's only in these unfortunate rare times that we're activated to do the kind of boots on the ground type of activities. But for the most part, it's primary prevention.
Do you work mostly with private industry?
We do, yeah. We're a full service organization that has been around for about 35 years. And so my experience has been in board certified in occupational environmental medicine, primarily with large and small businesses. But certainly we work on the public health side alongside our brothers and sisters on the community and state level public health.
What are you hearing from your clients in private industry about their concerns in terms of infection prevention? I mean, everybody's got concerns these days with COVID-19.
Mhm. Yeah, so we've seen their concerns raised and kind of shift as we learn more and more about SARS-CoV-2 and how it's transmitted. Early on, back in February, March, as we were working with industry, it was concerns around not just airborne, but surface contamination as a means of transmission. Obviously, we've seen data to suggest that the surface transmission is not as prominent as we once believed it was with the data coming out of Wuhan. So now it's shifted towards how do I minimize airborne illness, and in particular, there's been a kind of resurgence in the attention to airflow control in a workplace setting, and even guidance from CDC and FDA around how do we modulate the airflow in our facilities to reduce the number of airborne droplets that can transmit the virus. So we've seen these concerns obviously shift as we've learned more, and probably continue to shift as we talk about vaccinations and as waves of people become vaccinated. What's the strategy there with minimizing and who can come back and when?
Uh, do you find, I know this is just anecdotal, but do you find that they're having, the heads of companies, private industry, are having trouble following the guidelines and figuring out what they should be doing and not doing?
It all is kind of fragmented in terms of success at following guidelines, and those who are doing it well and those who are struggling. And what I mean by that is oftentimes it's predicated on the resources that they have access to, both locally and at the national level. We operate coast to coast, and as we do so, we've kind of been able to see the disparities between those who have local resources to partner with and those who have been struggling to find those resources. And it really hit home with regard to testing, right? Testing individuals to be proactive in regards to who needs to be at work, who can be cleared to come back to work and when has been across the board a bottleneck nationwide. And we know we're still struggling with that in terms of access. But certainly those preventative methodologies that include the screening that you mentioned before. Those who have taken advantage of digital platforms that are easily scalable at a reasonable cost to the entire workforce, we've helped usher in 20,000, 50,000 workers in the matter of weeks to do those type of processes, and they're doing it well and it's working. But we still see the community acquired or community transmissions struggling to prevent those because of lack of access to appropriate measures.
As you know, companies over the last couple of decades have been turning more and more to the open floor plan. I guess that's not going to come back. It's a fair assumption, right?
I would say so, and even if we look at things that are in place from a legislative standpoint, we look to Oregon and the measure that they passed and approved as their legislator on the 15th of this month. We can see that it's mandated social distancing, 6 feet, and it's cumulative. So even if we pass each other in the hallway, and in passing we only spend less than 2 minutes in passing, that is summed up at the end of the day over an 8-hour to 10-hour period. And if that sum is more than half an hour, you have to have measures in place to prevent that potential transmission, whether that's a barrier, a physical barrier that's non-permeable, or wearing face coverings and things of that nature. So there definitely are things that are going to preclude us from seeing that European style of office space.
You said earlier that you also work with some public health departments.
We don't work with them often directly. We work with them in tangent in terms of best practices and recommendations. And so in that, oftentimes we're collaborating with our cohort of occupational health doctors. There's kind of two delegations of OCDocs, if you would, those who work in the corporate realm and those who work in the public sector. And those are the individuals we work alongside of in terms of making sure across the board, we're recommending the best practice, the best science, applying the best knowledge, whether it's been published and peer reviewed, or whether it's, hey, look, this is what we're seeing locally in this area, and let's respond appropriately and proactively to help mitigate risk. And so that's how we've been prominently working with the community health departments.
Have you and your company personally reached out to an infection preventionist to seek some guidance in what you're doing, or?
Absolutely, yeah. At various universities, they're my. I've graduated from med school with some of them, right? I went to med school with the Surgeon General, right? Current Surgeon General. Now, I'm not saying I'm calling them up and giving you the advice day after day, right? But but I say that to say, yes, indeed, our colleagues that we work with and have been working with for years, decades in some cases, are those who we're calling up on the public side to help collaborate on what's the best practice for infection control.
Infection preventionists are now, for the most part, in the hospital setting, in the healthcare setting. Mm-hmm. Do you see them, I know this is a repeat of the question, but have you actually seen their expertise, or maybe them possibly moving into private industry or private industry hiring them? You see anything along those lines?
Yes, anecdotally I have, right? Have I, do I have a colleague that has done so directly? No, but certainly talking to the professionals at the different businesses that we counsel, they are reaching out to university, hospital-based experts, infection control experts, to get counsel. And in I believe one case I know of anecdotally, an individual has moved from that sector into the corporate sector, successfully so.
What's the questions you're getting? What's the main question you're getting from corporations lately?
It really is now all about testing. How do we test? What scale do we test with? And, what are the steps towards getting that access to the testing levels that we need necessary to mitigate risk? And it really is a local recommendation based upon local incidents, transmission. And those questions and answers are varied, right? If you have access locally, that's one scenario. If even if you have access, right, meaning that you have 10 facilities around you, the queue to get people in the door still may be days. And we're seeing that down in Miami, for instance, Fort Lauderdale area. We're seeing that also in the Midwest here in Chicago. And then we're also seeing new solutions come out. And some of the questions are around what are the saliva tests that can be done at home? How do we access them? What do we do to proctor that? And we've been doing thousands of those type of tests with our employers because they provide a greater access in a greater swath of the nation. So it really is the still how and when of testing that's predominated the questions from our employers.
I'm working at home. I don't know. It looks like you might be working at home right
You
now.
betcha. You betcha.
So working at home, you think this is now becoming the new thing? You see that happening?
Absolutely. You know, if I take off my EPI hat, my MPH, and put on my MBA hat, right, and we look at the economics of working from home, we know and we've seen some companies announce that significant proportions of their workforce will never come back to the workplace, and because it decreases the overhead for these operations. And incidentally, companies have seen an increase in productivity in certain sectors when people are working remotely from home. And we know when we study then putting the OC hat back on, workplace productivity, one of the main factors that drive productivity is being able to control your schedule a little bit more. And what we know to be true in terms of, and this may be geeking out a little bit too much on productivity, but individuals, we work best in blocks of time. And if you're working from home, there are less distractions for your block of time versus walking down the hall or going to get a coffee and having a conversation, right? And those small changes in the day-to-day rigor allows for increased productivity in some scenarios. And we're going to see that play out in again, significant proportion of the workforce never coming back to a workplace. Right. If you have the opportunity to retrofit your building and facilities with HEPA filters, right, then we see companies doing so. If you have an opportunity to update the exhaust system so that you're turning over the air 6 times an hour, that's been shown to reduce particles. Actually, that's the actual cutoff for the healthcare setting for isolation, right? 6 times an hour at a minimum. And so we know that companies are looking to do these things, retrofit facilities, so that it may decrease the opportunity for workplace transmission by minimizing those droplets that hang out in the air that are about 5 microns in size. And so it's probably less the abandoning the facilities versus just investing the capital to retrofit, because the ROI, obviously, of a more productive workforce and reducing the anxiety of the workforce from coming back to work when they need to is worth it.
Is there any, Dr. Anthony Harris, thank you so much for visiting Infection Control today.
Hey, thank you. I appreciate your time and I appreciate the opportunity.